thank you for coming to my presentation. I know it's like the first presentation of the conference, and what I'm going to be talking about today is looking at He Lei no Emalani. So this was a book compiled by Puakea Nagamara of almost all the chants written for Queen Emma. There's about 204 oli and mele in here, and that still doesn't cover it all. But I'm going to use excerpts of this book to explain what we do at Queens and what I do and what my role is, and all in an hour. We'll try this. So thank you for coming. If you also are interested in Queen Emma, her biography, this is an excellent resource. It's written by George Kamehameha. I think it's still in print. You can probably find it on Amazon. But it's about her life story, and you can really see her progression of her life. And so I'm going to try and highlight things about Queen Emma in this presentation while talking about what we do at Queens and what I do in my day-to-day work. So I'm the director of the Native Hawaiian Health Program at Queens, and I've been there for almost 6 years. I started the program and I built it from kind of like just from taking a strategic plan and implementing it to a full-on program, and you'll see all of the fun things that I get to do. And can I also give a plug that tomorrow I'm going to be moderating a panel of some fabulous women from Queens who are going to talk about what they do at Queens, because we're not only doctors and nurses and pharmacists, we do a large number of other things, and some personal challenges that we've had to overcome, just like Queen Emma has in her life. So I'm going to try and keep to the slides. If I go off on a tangent, just like stop me here. Okay, so Queens was founded in 1859, so that's about 153 years ago, by King Kamehameha IV and Queen Emma. And this is the first building that was built in 1860. So of course, they had to fundraise. They went door to door to raise $13,000 back then, which, if you translate that to current day, is about $350,000. So if you can imagine the fundraising that you do for your kids, for friends' teams, or when you go to a halal fundraiser, King Kamehameha IV and Queen Emma raised the equivalent of about $350,000. So try doing that on your own, knocking door to door, right, selling Zabi's chili or whatnot. Emma Kalani Kaumaka Mano Kalele Onalani Naea Rook was Hanai by her Hanai father, Dr. T.C. Rook, and Grace Kamaiku'i Rook. So she was from that era where they used to Hanai, right, a practice of Hawaiians taking care of other close family relatives. And so a lot of the influence of her being exposed to medicine was from her father. Her father was a Western doctor who utilized Western medicine and used to run a kind of like an outpatient dispensary clinic. And it was through this, so when she was about maybe 14 to about 16 or 17, going to school at the same time, she would help assist in procedures. So, so she was ma'a to like blood, she was ma'a to inoculation, she was ma'a to all of these Western medical techniques. And so this, I think, was one of the main inspirations for her as a practitioner and as a medical-oriented person. So I'm going to reference one of the first things, a mele ku auhau, or kind of like a genealogical chant. So all of the mele in this book are classified into certain things. The first one being mele ku auhau, genealogical. Eo kalani kaumaka mano, kiali inana e puhi puhi o Hawaii. Here is the royal one, beloved by the multitude, the chiefess who will cause Hawaii to blaze. So in essence, there's all of these mele written for her that really emphasize her contributions to her people, and I just like to refer to that blaze part, right? She's ho'a, she's igniting inspiration and igniting something for all of her people. So I'm going to flip back and forth between things like this. So when Emma was in her early 20s, she married King Kamehameha IV, who was already king. I think he had been king for about a year prior to them getting married. And of course, Alexander Liho was, they're all groomed from infancy to become leaders. They went to the Royal Chief's Children's School, which is where Royal School is located today, just pretty much kitty corner to Queens. So we have a good relationship with that school. And it was a semi-arranged, but they had crushes on each other from when they were small kids. So in essence, I kind of think she kind of married her a long time relationship sweetheart. It was a union that was, celebrated, rejoiced. There's pictures of them getting married at actually not pictures, there's drawings of them getting married at Kuhinapapa Church. And so this is where she really took reign and was able to kind of have the power and influence she could for her people. So Mele Ma'i, for those of you who don't know what a Mele Ma'i is, it's a procreation chant, and in a sense highlights and glorifies the genitalia of important people. And so that would highlight the procreation and the succession and the perpetuity of our lahui. So he ma'i keia no ema, ko ma'i puni ma ka'ikai, wa la'i ka hana ke kime, ho'ola'a i kula o pu'uloa, e lua mea ho ma Eva, and it continues on, but Eva, we are in the moku of Eva. And I think I just found out this morning we're in the ahupua'a of Waiau. Mahalo. Ha'ina kai no ko ma'i u'u ma'i o Emalani. So Emma's ma'i was actually named, and the name of her ma'i was u'u. So if you see references to this in the mele and the books, it's not very common practice today that we name our ma'i. Some people do, but just so you know that this is a recurring thought, and it was well known throughout the islands. Technically it's perfect. All right, let's just do page down. It's frozen. There we go. Okay, so after about a year or two of marriage, she gave birth to the son, also known as Kahakua Hawaii, right? He was going to succeed the throne from his father, Albert Kawi Leo Papa Kamehameha. Very precocious young boy. If you ever go to Hanai Lama, where the Queen Emma Summer Palace is, they have some personal belongings of his. But sadly, and most of you know this story, at the age of 4, he passed away, and they think it was, at the time they thought it was rheumatic fever. Oh, what happened? Somebody playing around. Oh. I promise I didn't touch anything. I should just use this. So he died at the age of 4. And for anybody who has children, so I have a 4-year-old right now. And to think of her, leaving is just heartbreaking. And so you can imagine the pain that she felt. Not only was she going through this, but she's going through this in the public eye, right? She's a celebrity. She's well known throughout the islands, beloved. And for her to lose her son was just devastating. And for those of you who also know, not even a year later, probably about 11 months later, her husband passed away from grief. And so she takes on different names because Hawaiian common practice was to take on names after significant events. After her son died, she was renamed Kaleleo Kalani. When her husband passed away, she took on the name Kaleleo Nalani, or plural, the flight of the heavenly chiefs. So whenever you see mele done for Queen Emma, you'll know Kaleleo Nalani is Queen Emma. So mele makena, so this is similar to kanikau or wailing chants, chants about deep grief and sorrow. And I just picked two. The top one being for her son, and the bottom one for her. This left side for her son, the right side for her husband, and you can just see these are the ones, the paukus, 192, 194 in this book. She wrote 4 of them herself. All of the others were things that were composed for her son and for her husband, but these were the ones that she wrote herself. And so she went through a very cathartic time in her life. If you think of everybody who you love, that's dear and close to you, leaving you suddenly in a very abrupt way, you can see how one would just kind of turn inside themselves. It would be really easy for her to kind of shun the public eye. And so I think these 2 pauku really show the eha, or the pain in her heart when that happened. Yeah, the first one being her son. Calling to you is your dear son, right? So she's envisioning him calling to her. And then the one on the right for her husband, that opening a gap in the loving relations of the 2 of us. This heaviness shall continue from the love that exists. So very, very deep and dark time in her life. However, I don't end there. Of course, I don't want to end them. So before, when Prince Albert was about 1, they created this hospital. And they were actually looking to have either a school or some type of educational institution, but because her father was a physician, and because of the amount of epidemics that she saw going on with her people, they decided to create this hospital. And of course, in the beginning there was much controversy because she actually shunned the traditional Hawaiian healers. So today we're kind of doing this comeback around to traditional healing. But back then, she really was, no, I need to give my Hawaiian people this Western medicine component. And so that was her mission, her husband's mission. They lobbied at the legislature. They lobbied, again, door to door to raise money for this. So the original name of Queen's Hospital was Halemai o Wahine, or the Hospital of the Lady Chief. So that's how we know it as Queen's Hospital. Subsequently, I think in the 80s, we changed it to the Queen's Medical Center. But everybody, if you look at the news nowadays, everybody still refers to it as Queen's Hospital. Most of the buildings have Hawaiian names. We have Kekela, which I'm sure some of you heard of, is our mental health inpatient facility. Kekela was her birth mother. We have the Pauahi Wing, because Charles Reed Bishop and Princess Pauahi gave a large donation. They were also thinking of creating a hospital or some type of healthcare to help the people. And instead, because Queens was created, they actually were kind of encouraged to create the Kamehameha schools. So in a sense, I like to think that Queen Emma had a role in playing with the creation of Kamehameha schools as well. And we have Kina'u. What are some of the other buildings? Kina'u, the Queen Emma Tower, Kamehameha Wing. So when you come and you visit a lot of the places at Queens, hopefully it's for a birth, you know, and I always have to say like, oh, hi. You know, when I see friends, like, you're here for a birth, right? Oh, well, you know, Auntie went to surgery. It's like, okay, well, you know, we'll take care of you. Okay, and so let me get into a little bit more about the actual hospital and the health systems itself. This is our mission. The Queen's Health Systems is this overarching umbrella organization. Within the Queen's Health Systems, we have the Queen's Medical Center, Moloka'i General Hospital, Queen Emma Land Company, which holds all of our land holdings. If you don't know, Queens owns a large part of Halawa Valley. We have large property in Kauai High, right next to Kamehameha schools in a sense. But the one that actually gives us the most return on our income is our Waikiki properties. So we own International Marketplace. And if you know that whole block that goes all the way from Kalakaua to Kina'u, we own that whole block where the Miramar is right now. We've actually taken over that hotel. That place that used to be the old Perry Smorgies, I can't remember what it is now. It's some other buffet. Oh yeah, it's a Hello Kitty themed buffet. Yeah, Queens owns that. So in a sense, the Queen Emma Land Company, even though it's really 10% of the land holdings of Queens generates about 90% of the revenue to help support the mission of our hospital. Our vision is to be the preeminent healthcare system in the Pacific, providing superior patient care, continually advanced through education and research. So we are a tertiary medical center. Tertiary meaning you have different levels of healthcare. Your primary healthcare provider is going to be like your internist, sometimes your OBGYN, the person you really see when you first have any type of illness or sickness. Secondary care would be specialty care, sometimes again OBGYN, or if you sprain your ankle, you might see an orthopedic guy. GI stuff, you'd see a gastroenterologist. Derm for your skin. And then tertiary is usually when it gets so bad that you have to be hospitalized and or have a very, very specialized type of treatment. Our philosophy of care, Queen Emma stated it herself that people are the key to healing. So just by having this awesome Da Vinci robotic surgical machine doesn't mean that we're going to be the best at it, right? Somebody has to operate that machine. And so we have a hospital-wide philosophy of care called Loko Mai Kai. We define it at Queens as inner health, but it also talks about the relationships that we have with the patients and broadening our scope to not only just treating them, but also looking at the spiritual components, looking at a more holistic perspective. These are the values that all of us get educated in, and we wear it on our badges every day. The simple mnemonic is care, compassion, aloha, respect, and excellence. So we celebrated in 2009 our 150th anniversary, which is a huge milestone considering how difficult it is to do business here in Hawaii alone and in healthcare. And just to tell you a little bit about the scope, we are the largest private hospital, acute care beds, meaning that you have 24/7 care with a nurse, 28 subacute beds where not as much care needed, but definitely need hospitalization. You're not really able to go home yet. We're Joint Commission accredited. We have multiple residency programs. We are affiliated as a teaching hospital with the University of Hawaii and the Johnny Burns School of Medicine. And in 2009, we actually got magnet designation, which is a designation for nursing excellence. So all of our nursing staff are magnet designated, and we're going through a reapplication as we speak. So who makes up Queens? We have over 5,000 employees, and that's, again, this is a QHS perspective. So in all these different companies, we have over 5,000 employees. You probably are like 1 or 2 degrees separated from somebody who either works at Queens, right? Nursing staff, physicians on staff, and this is taken from last year. This is just the Queens Medical Center alone. And so this is last year. This is before HMC this way, right? This is before HMC closed. And so now they're talking that because St. Francis West HMC closed, our admissions have doubled, and our ER visits are probably going to hit closer to 70,000 per year. So you can see I've had anecdotal stories of people waiting 17 hours. Just where the emergency room is on divert, meaning that they're at max capacity, they can't take any more people. Divert up to 3 times a week. So just think about the impact that one hospital has, another one picks up a bulk of them. And that's not even Palimomi's number. So Palimomi also, I think they've tripled, even more. So this is our hospital today. So it looks very different from the original facade. I do want to point out, right here, if you ever visit Queens, there's the original crest of the Queens Hospital. It says QH, Queens Hospital. And so that part of the hospital actually has been retained. We also have 2 historical buildings on campus. We have the former Hawaii Medical Library and the Harkness building. Harkness was a nursing dormitory. So back in the day, if you wanted to be a nurse, you had to live, work, learn in the same place. So if you ever look at the yearbooks, they had lots of fun. There was a pool, they had meals. Just a couple more numbers. The surgery department, so this is again before HMC closed, nearly 7,000 inpatient cases. Inpatient is when you stay in the hospital overnight. Outpatient is when you just come for a procedure or an appointment and then you go home the same day. Our emergency department is a level 2 trauma center, and so this is going to just skyrocket this year. This is fiscal year 11 data. We have a number of specialties when you come to the office. The thing that I want to point out is that cardiac, medicine, neuroscience, and oncology are all ones that I have a special pilina to because I work with those service lines and I help do specific Native Hawaiian initiatives. Okay, I'm running out of time. Just the plethora of health careers, because I encourage everybody to go into healthcare. I think it's in our nature as Hawaiians to care for each other and take care of everyone. So when I was growing up, the only thing that I thought healthcare was physician, nurse, or even pharmacist. And pharmacist was like, whoa, you're kind of getting out of that box. But you can see all of these professions have specific purposes, especially at Queens. And not all of them need this professional or graduate degree. Like the list is actually longer for the ones that don't require a degree. So if you're interested, please look out and seek out, and we give scholarships to some of them that I'm going to go through in a minute. So Mele, Kalai, Aina, I'm throwing this in because this is patriotic. Queen Emma was also a leader and a visionary. Eya e Emalani a hikimai o ke kia pa'a oe ke aupuni a ohe kupu eo e nā we mai. Emalani approaches soon to arrive. You are the steady master of the nation that no rascal could cause to rock. So in a sense, I think we've kind of fulfilled this premonition that we are the stable source that people can look to in times of need. If you need to come to the emergency room, please do. Don't let any insurance fears cause you to not seek medical care. I'm a full-on advocate for seeking medical care when necessary. And then I know I'm like nearing the end, but I just want to also share about my program. So this is what I do. I run a Native Hawaiian Health Program. It's at the Queens Health Systems level, so I get to work with a number of different companies. And just to give you a snapshot of Native Hawaiian health, these are the causes of death. And if you look, cardiovascular diseases, these are heart disease, heart attack, strokes, are almost 1/3 of what Native Hawaiians die from. And mortality, I know it's kind of depressing, but mortality is used as kind of the benchmark or an indicator of how healthy a population is. Cancer, diabetes, and all of these other ones fall into trauma or things that are not easily classified into one thing. A lot of this is a result of multiple things, like say you have cardiovascular disease and cancer together, cardiovascular disease and diabetes. And this one, although it's 2010, we still are at way overrepresented in all of the adverse health risk behaviors. In particular, smoking, overweight, obesity, diabetes. We're slowly creeping up. But, I just heard a report that the Filipino population is slowly surpassing Native Hawaiians in terms of incidence for diabetes. And of course, health status, rating your self-efficacy as poor, where again, this is not where we want to be in terms of Native Hawaiians being ahead of everybody else. So what we thought about at Queens was to have a specific targeted direction on how we're going to address Native Hawaiians within our scope, because we know we cannot solve it all. So we looked at the major health issues. We prioritized the needs based on those 2 slides. I mean, much more data, but in a nutshell, based on those 2 slides, we looked at what are Queen's strengths, what are the programs that we have solid foundations in, and how would we align the needs of the Native Hawaiian population with them. And we came up with some Native Hawaiian health strategies, clinical outcomes, research, outreach and access, and training. So our Melema Ka'ikai, so Melema Ka'ikai is a whole chapter on traveling chants. She was a very well-traveled ali'i. And I'm sure I just threw this in because most of you will know the song, the Hala o Nawe. Nani walena hala ea ea o nawe ke kai ea ea. I know you guys have heard that. I'm not going to sing the whole thing because you don't want to. But again, then I just wanted to put this in here. Aiwa me o kalani kauka o waiahulu o ka halawa ola malui ka halau koa. So my hula sisters, this was our Mary Monarch 2006, I think it's Mele, and it talked about Queen Emma traveling up to Alakai Swamp on the island of Kauai, and I think this trip in particular, when she went up to Alakai, after her son and her husband passed away, she retreated to her home in Lawai, Kauai, which is South Kauai. She went on this trek up to Alakai Swamp, and if you've ever been on that trail, it is steep, it is rough, it is cliffs on either side of you. And I think at some point they were traveling, so it wouldn't be just like a day hike like how we go hiking. This is like couple weeks long trek, literally a trek up the mountain, right? There's no like nice cleared pathways by DLNR, Parks and Rec. So she had this time spent with her entourage traveling up to Waimea, and when it was pouring rain, bitter cold, everybody's like, come on, it's like my kids in the back. Are we there yet? And like, do we have to really go to the top? Because I think I've seen enough of Waimea, Canyon, that kind of stuff. She was the one like, we're gonna just go and we're gonna take it to the top. And I think what is reflected in this mele is that when she reached the top of Alakai, she was able to release her mourning, and she was kind of like reborn in a sense, and really reinvigorated, and that was kind of like the ending of that mourning period for her, and she was able to finally move on with her life and really make a difference to her people and really commit herself. And after that, she went on to some political endeavors, running against Kalakaua in an election, had a very, very strong following of supporters that would, fight to the death for her. But she acquiesced and she let Kalakaua go, and it's all written in this book. And if you ever think that Hawaiians don't have any drama, you should read this because. And just as a sidebar, Lili'o Kalani was one of her bridesmaids at her wedding, and by the end of the turmoil and what have you, they were on non-speaking terms at the end. So if we all have our moments, we all have our best buddies, and and things happen. So she's human. She's just like one of us. So again, halawa ola, also referencing kind of that ola, that life within her. And so visiting Alakai Swamp, she was able to really focus back, finish the mourning, and kind of move on and leave this legacy. Because after that, she also helped to found St. Andrew's Priory, which is an institution for girls, and also helped bring St. Andrew's, bring the Anglican Church from England to Hawaii. So these are very pro-British elite. So this is my program. We have our own vision and mission. Dr. Hakaka is my medical director, so any type of clinical things, I have him on an advisory level. Jane Talfaki Sam on the right is one of my coordinators, and she helps me run grants. Joanne Kimura on the left, she runs all of my data. So if at any time people want to know anything specific to Native Hawaiian statistical data, she compiles our data warehouse. And then Janine Johnson, and I have to give a plug, she's giving a talk tomorrow on Paiko Ridge and the land use. Paiko is on the east end by my house. She's going to be giving a presentation tomorrow afternoon. And I just have to give the disclaimer, we're all postpartum, well not we, me and Jay, we're both postpartum in this video, I mean in this picture, we don't necessarily prove, but it's the only one we have of everybody. So, okay, I'm going to go through each of our strategic areas very quickly. We have clinical outcomes that I manage and maintain. And so these are where this is my fun part where I get to work with the actual service lines. We call them service lines. In cardiac, I work with the vice presidents to say, what is it that you can do in your area specific to Native Hawaiians, and I help give seed money and I help shape their objectives for the Native Hawaiian patient. So what was really needed was pharmaceutical reconciliation. A lot of people will come in with like 5 meds, and when they leave, it could be as much as 21. I cannot even take a vitamin every day, so I can't imagine taking 21 different medications and making sure I take them at the right time, at the right dosage, the right amount, right? And this is the coolest thing. We have wellness consults in this cardiac area for free lomi, reflexology, guided imagery, music therapy, healing touch. And so what we found was that it really brings down the anxiety levels pre-surgery and post-surgery. Because if you're in the cardiac unit, usually you're here for bypass or heart failure. Your heart is not pumping the blood that it needs to get to the rest of the body. And there's a lot of anxiety related to having a severe heart ailment. Cardiac, because this was our first service line, also was able to get poi on the daily menu. So you can't come and get poi at the dining room if you're a visitor, but if you're a patient, not that you'd want, again, I just said, not that you'd want to be a patient, but if you are, you can get poi every day on your tray. The oncology was a little different because cardiac has very set and specific guidelines for heart care. Oncology, you have a wide range of, you have the $10,000 treatment and you have the $100,000 treatment, and you have clinical trials, and you have the different site-specific cancers. So there's a lot more variables involved with oncology. So one of the biggest things that we asked our patients was that, what is the biggest fear of cancer? And a lot of times they didn't tell us it wasn't necessarily the cancer itself. Yes, that is an important part, but it was navigating this financial piece to it. And what does my insurance cover? What doesn't it cover? Do I want the Cadillac treatment, or do I want the Toyota Corolla treatment, or what is best for me? It's up to you and your physician too, whether or not you want to pursue chemotherapy, radiation. There's all these different methods. So we have a dedicated financial advocate that screens all the Native Hawaiian patients first and advises them on what kinds of coverage their insurance will capture, and or look for resources for them on helping them pay for this care, right? You could have, like, again, $10,000 treatment, $100,000 treatment, and if your copay only covers $5,000, that's a big difference for you to pay. And what we feel is that you shouldn't determine your choice of treatment based on what you can pay, right? We also have a survivorship program enrollment where we follow and track patients 5 years down the road. And I have MGH no-show mammography rates because before we started this program, in order to get a mammography on the island of Molokai, where our sister hospital is, Molokai General, you have to wait about 6 months, take time off of work, fly over to Oahu, get a car, find some transportation to Queens, get lost at Queens, figure out where you gotta go. And so we helped train a radiological technician, which went away for ultrasound, and mammography technician. They bought a mammography machine for MGH. And so now you can actually almost get same-day appointment on Molokai. So saving yourself a trip, saving yourself time away from work, and also diagnosing it sooner. Because if any of you know cancer, 6 months could be the make it or break it point between stage 1 and stage 4, depending on what kind of cancer it is. So one of our biggest success stories. Comprehensive weight management is looking at bariatric surgery. So bariatric surgery is Roux-en-Y. It's your gastric bypass surgery where they reroute the base of your esophagus to directly bypassing your stomach directly to your intestines. And so this is for morbidly obese patients that cannot lose the weight because of some other medical reason. And what the literature says, literature meaning standard of practice in the field, it says that when you go through bariatric surgery, your type 2 diabetes is actually resolved. So it's seen as almost a cure for type 2 diabetes. Because we've seen patients that have gone through this surgery, the day of their surgery, they may be on, 40 units of insulin. After the surgery, 0. They go back there. It's a metabolic change that regulates their insulin levels. So we're looking to see if that also happens with Native Hawaiians, because it's only really been studied in the generic population. We want to see if this is one of the things for our morbidly obese patients. Medicine, again, we have targeted rounding on Native Hawaiian patients. So we were able to get a list of all Native Hawaiian patients. We have a dedicated APRN who rounds on the Native Hawaiian patients first to make sure that all of their needs are met or they understand why they're in the hospital. If they need to be triaged to any type of educational programs or services, they will do that. Again, pharmaceutical reconciliation. And medicine is your generic I don't want to say one-stop shop, but generic, everything involved. It could be diabetes. It's not specific to heart care. It could be cellulitis because you haven't taken care of your feet. Neuroscience, we have the Kuhinapapa stroke study. And what we initially found was that Native Hawaiians suffer from ICH. ICH is intracerebral hemorrhage or bleeding stroke, 10 years younger than the population. And when they looked at the data, there's also a lot of records of methamphetamine use, right? Meth, crystal meth. So what they wanted to find out is are people having stroke younger because of meth or because of some other cause? And lucky to say it is not methamphetamine related. It is due to cardiovascular risk. So it's double-edged sword, right? Yes, all right on. It's not because of meth that we're getting strokes younger, but it's cardiovascular risk. So it's undiagnosed hypertension or untreated hypertension. So undiagnosed meaning you don't know that your blood pressure is high over a sustained period of time, and or you were diagnosed as hypertensive, but you cannot afford the monthly hypertensive medications. And hypertension is also known as the silent killer because you can't really feel a difference when your blood pressure is high over a long period of time. So when people say untreated hypertension, it's like, well, yeah, I have a hypertension, but I feel the same, so no need to take that medication. Or, like I said, they don't have the means to pay for a monthly copayment, say around, could be anywhere from $5 to $50 a month, but that all adds up. And then finally with diabetes, we have a diabetes inpatient team who again rounds on Native Hawaiian patients. We have a transitional clinic, which we try, and the way healthcare is going now, spending time in the hospital is our responsibility and our kuleana, but with the way federal legislation is moving, is that we are not going to be responsible even when you get discharged. Because if you come back and get readmitted for the same thing, Queens cannot bill. We cannot get reimbursed for the services that we provide. So we're really looking at taking the patient outside of our walls and following up on them, making sure that they have the resources that they need. And finally, prediabetes. Prediabetes, there's certain conditions biologically that may predispose you to diabetes, or there would be family history. Prediabetes is now becoming more and more of an awareness issue because of we've seen stories of people coming in with prediabetes, they leave the hospital, they come back, a couple months later, they have full-blown diabetes, they be on insulin, poking your finger 4 times a day. So addressing this early on, we help prevent diabetes later on. And if you know about diabetes, it's a comorbidity, so it's not going to help your care. It's only going to complicate all of the other things going on with you. Okay, so enough about words. I'm going to go through a couple slides about the design of our hospital. So this in particular is a comprehensive care unit. We try and incorporate soothing colors into our hospital. This is our cardiac inpatient. So this is the coolest thing. If you walk through, these lights change colors to try and kind of give you a soothing, because whenever you're on one of the intensive care floors or inpatient floors, it's a tense time for you and your families. There's always artwork somewhere in the rooms, and so this is, we try to put some Hawaiian art motifs in the hallways, because a lot of the hallways don't have windows. The way our Kuhinapapa Tower is arranged is that it's kind of this donut-shaped building, and so you're kind of thinking, like, why would you spend so much money making a donut? Why not just make it a block? But the reason was we listened to patients, and everybody, when you're in a patient room, you want a window. You want to know if it's night or day. You want some natural light to come in. So each patient room has a window. And for the corridors that don't have a window, we try to put some nice natural landscape art. This is the cardiac invasive lab. So this is where if you have a clog or blockage of your arteries, you would come to this unit, and they would either open up your valves in your heart. And if you notice along the cardiac, there's always panels with designs on the roof, because most of the time, if you're on a gurney laying down, you're not going to look at the nice artwork on the side. You're looking straight up at these jarring fluorescent lights, and so we try to put some design elements into that. This is the invasive lab. So if you just look at the equipment, it can be kind of intimidating, very scary. You're like, what is that going to do to me? But we try and also incorporate elements of nature to try and, as much as possible, provide a serene environment. And especially at Molokai General Hospital, their imaging department has a wall-to-wall, floor-to-ceiling panel of the forest with actual bird sounds in there. So very, very relaxing. So if you ever want to get a scan, I would recommend going to Molokai. Okay, and then the next area is healthcare training. So I'm a big advocate of school advanced knowledge. We provide scholarships to 2 programs, the KCC, because they are non-degree granting programs, which federal funders and most scholarship agencies do not support. If you want to apply for federal aid, like with the FAFSA, it usually has to be a degree granting program. So programs at KCC are certificate. You can be a radiological tech, ultrasound tech, respiratory therapist, that whole list on the right-hand side of that slide. And we give scholarships of up to $2,100, which actually covers the whole year for some of those students. In 18 months, they can get out of the program and actually start working in the field. This Windward Community College Nursing Pathways is a certified nurse aide, LPN to RN pathway. It looks at making a livable wage, right? So CNAs make about $10 to $12 an hour, which if you try and survive in Hawaii on that is very difficult. And it takes them to the RN, where you can make upwards of $40 an hour for being a nurse, night ward. I wish I had known what nurses make back when I was back in school, because if you're a charge nurse working on night shift, you can make up to $150,000. I mean, it guaranteed, it is hard work, but when you talk about livable wage in Hawaii, at least you'll have the opportunity to buy a home, hold on a home. So that pathway really helps support students through that as well. And this is one of the coolest ones that I have, the Howard Hughes Medical Institute grant. We have a partnership with Stevenson Middle School, which services the Kewalo, Wahine, and Papakolea homesteads, and is less than a mile away from Queens. And we help support them with student support, faculty support, substitute teachers, faculty training, and most importantly, family health science evenings. So you would not believe, it's so easy to get kids interested in science, because we want them to become employees at Queens. And the hardest barrier that we found in this grant are the parents, because a lot of the parents feel, well, yeah, they're smart, yeah, they like science, but you know what, I need them to help support this family. They're going to go work with their uncle in construction, and if you think about the longevity of working in construction in Hawaii, it's not a long term, it's not a reasonable or stable type of work. Sometimes you work, you have health insurance, and then you're on unemployment, and you gotta apply for quests. So we try and show the families how important science is. We have all of these careers at Queens to do that. And we also support the JAPSOM Department of Native Hawaiian Health with their Imi Ho'ola scholars. We have a research fellowship through their department. I think I have another picture. Okay, yeah. So that's the Windward Nursing Program. That's some of the Stevenson students that come to our school. We have a health fair every year to try and get them to get to know some of the other professions. And it's so funny. These kids are not afraid to ask. The very first question when they come into the, how much do you make? I swear, that is their first question. They're like, $35,000. Okay, I'll get back to you. And they go to the next one, how much do you make? These kids are smart nowadays, I'm telling you. One more area of my program is research. I do obesity research, again looking at type 2 diabetes and bariatric surgery. I've done a translation, so translational research is now kind of this new buzzword of taking something that's learned in the bench side and applying it in the field, or the other way around, taking a community-based program and applying it to a clinical environment. So I have a grant with the Department of Native Hawaiian Health to translate. It was an educational material called Malama Pu'uwai, and we put it into a clinical setting so that we can educate people, because hospitals historically have not done a lot of education. A lot of times, you diagnose, treat, and send them on their way, hoping that they don't come back. We also have, this is called the R-Matrix grant. Dr. Todd Sito and I are on a community collaborations core where we try and network researchers with community people and hospital people so that we're in collaboration, kind of all on the same page. And then Pili Ohana is a lifestyle management, it's a weight loss and weight maintenance program that Keave and I help. We actually only do it for employees right now, but our mentality is if we have healthy employees, we are better able to take care of our patients. And then the last area is access and outreach. I run the Heritage Program, which is the King and the Queen's birthdays. We have a Heritage Day, which is kind of like our Founders Day every year. Oh, I must have pictures. So Felice and I, we host a service at Mauna Ala, and then we also have a service on campus. I also have a Hawaiian language program that I have 3 teachers, one of them including myself, when I have the time, to try and get people, especially people from the mainland who work at Queens, to even pronounce Hawaiian names. My biggest thing is to teach them to say Kamehameha Auditorium and not Cam-Aud, which is what it's known as in at Queens. And I also have the Queens Historical Room and Mamiya Medical Heritage Collection. So these are all of the artifacts and medical documents of Queens, one of them being the original incorporation of the hospital. Nali Mahana o Lona Puha, I'm a part of the Native Hawaiian Health Consortium with a number of other Native Hawaiian health organizations. And Lona Puha was one of the first known healers who learned it from what we think of as akua or deities. And so we have made it a mission and a pact to work together to address Native Hawaiian health. So there's education, political science, social work, hospital care, all with the focus of looking at how do we move the Native Hawaiian health status higher and not do it alone. Because Queens cannot do it alone, OHA cannot do it alone, Kamehameha schools cannot do it alone. We all have to kind of get on the same page and what is it that we can do. So if my kuleana is hospital, what can I do at the hospital that will help bridge my work with OHA and what they do in the community, or a community health center and how they do it. So this is where, this is a really fun part of my job, where I get to go out off campus and get to work with the other Native Hawaiian health organizations. So again, Queen Emma was much beloved by her people. Again, hundreds of mele have been composed in her honor. She's, I think, one of the most, I'd say, popular queens. If you look at Mary Monarch, there's always a number of mele honoring Queen Emma. She's one of the most well-known too. When we look at in the classrooms and show kids pictures of Queen Emma, they will know that that's an ali'i and that they can recognize her. And again, dying very young. The reason why we named it the Queen Emma Stroke Study is Queen Emma actually died of a stroke and complications due to stroke. So if you think about, oh my gosh, 49, when she got married in her early 20s, she actually created the Queen's Medical Center when she was 23. So if you think about, okay, what was I doing when I was 23 years old, assuming that you're all over 23. We all just turned 23 last year, I know. I was not in the mindset of what legacy am I going to leave for my people, right? When you're 23, I was in college, I was like working my first job, not making very much money. My priorities were very much not aligned with Queen Emma's. But in her lifespan, you know, outliving her husband, outliving her child and only child, she had accomplished so much in such a short amount of time that it's no wonder that so many people honor her the way they do. So I think this is my last one, Meleho Ihi. It's one Oli number 8 that I think really personifies herself, a grandchild of Kalani Opu'us, which is the ruling chief of Oahu. She was known for her soft voice. She was very soft-spoken. And that the maka'ainana, or the common people, were just full of aloha for her every time they saw her. And I think that she was revered in the highest of the heavens. And when you talk about Lahui, there was a distinct number of people that were, I don't know, how am I on time? 5 minutes. So we did this at our 2009 Heritage Day. We composed it, we put an ad to it, and I had our Heritage Day committee and I had our executives, our vice presidents, learn this and do the oli at one of our events. So this one I think has specific meaning to Queens in a sense. And so these are various pictures of her throughout her life. You'll see pictures of her stylized. Most recently, Queens commissioned a portrait of Queen Emma, but it's very modern looking. It looks like she went to MAC and got a makeover, and her hair has highlights. But you've seen variations of these. But if you think about the time that she was in, very tumultuous, not very, more tumultuous than today, but really, if you think about the personal challenges that she had to overcome, it is just so profound that what she was able to accomplish in such a short amount of time, and to leave this legacy. So a lot of people maybe don't necessarily connect Queens Hospital or Queens Medical Center with her as a person. So I hope that today I've actually shared some snippets of her life that really demonstrate how Queens Medical Center has become this enriching part of the community, and I think that's it. Wait, oh, okay. So, and I always leave with this quote: "So long as sickness shall exist, there will be a duty imposed upon us." And I think all of us at Queens represent this. We'd really, really love to work ourselves out of a job. That if everybody, did their own kuleana, took care of their health, that we wouldn't need tertiary medical coverage. And I hope that all of you make it to the health screening, and that, Michael Jackson, man in the mirror, start with the person in the mirror, start with yourself, take care of yourself, if not for you, for your future generations, and so that you can be a role model, just as Queen Emma was to all of us in, leaving that legacy. And I think that's what the biggest message is you want to leave that legacy. You don't have to leave a hospital, but you can leave something to your ohana for the future. So, mahalo. And when I have job openings, I'm going to call.
So this is only a question, kind of a mahalo or something, but I'm a student at UH in Hawaiian Studies. So through that, I've learned a little bit about the formation and specifically the struggle that Queen Emma and kind of the work went through to establish the hospital. And I didn't know she was only
Yeah, 23 when they're going, you know, like knock, 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 aloha.
And when she was facing, you know, in the media, you know, attacks from very powerful holiday and missionary, you know, community, that what they were doing was evil. And they were really protecting and looking out for the interests of their people without moral judgment. Because there were prostitution, STI.
We had a whole ward for prostitutes.
Yeah, and they were asking
not
to help them to, you know, stop the spread of disease. And they were facing an attack when she was only 23 years old.
Yeah.
So I love that. I love this presentation because it's so important to keep the hospital framed within Queen Emma. Sometimes we take for granted Queens, like it's just a Queen's hospital, whatever. You know, but it's Queen Emma's hospital. And as the mother of a 2-year-old daughter, I want her to feel, as a Hawaiian growing up here, that she's connected to this institution because that institution connects us to a very proud part of our history. So I really appreciate all the effort that's happening right now to keep it in the proper context.
Yeah. No, yeah. No. And exactly, you know, like the pressures that were upon her as a li'i, I mean, everybody has personal pressures as a mother or a sister or whatnot. Yeah, I mean, she had pressure being pro-British, right? And you know, all along this time, the Americans are looking to take over our aina. The pressures of being a mother, of, you know, I know some boys that are very kolohe. Boys are up and at 'em, you know, chasing after a boy. And at the same time, a lot of resistance from her own people because she was pro-Western medicine. The medical care at the time was very pro-traditional healing, right? You would go to a kahuna, or you would seek out la'au lapa'au, and she totally kind of removed herself from that and said, and had to convince her own people that Western medicine was good for them. So, and, you know, even when she got married, there were people who actually protested her, saying that she didn't have enough ali'i blood because she was hapa. They really challenged her, and you know, when you're 20 years old, I don't even know if I could take that kind of pressure now. Yeah, and for her to rise above that and still live this legacy is remarkable, and we don't always talk about it. We may learn about it in Mele, in a halal, or we may see it through, Queens gave support, or Queens is hopefully going to buy HMC. But really, it all kind of comes down to this Pai foundation of Queen Emma and what she intended. And I really think she would be proud of what we've built it to. And, you know, along the way, there's been, you know, courses to and fro, but, you know, we are that steady facility, and we want to try to maintain that. And so, utilizing the resources wisely and making sure that the resources are here for generations. Our goal is to be around for another 150 years. And how do we do that in today's economy and social political arenas and all of that other fun governmental stuff is challenging. So whenever I get frustrated, I look to Queen Emma. You know, I don't, you know, what would Queen Emma do? But I don't internalize her that much in that sense. But, you know, in a way, I feel like I have an obligation and a kuleana to be able to be the best at what I can do, so that this program, when I'm long gone, will still be going, and that Queen's Hospital will be here long after I'm gone. Okay, mahalo.
Not a question, but it's really dear to my heart, the hospital, Queen Emma, because my grandmother was one of the first graduating class as an RN at the hospital in 19.
I also have.
I think two of them did was on that list, and her picture and all of that.
Oh, mahalo. Okay, so I know you're done. I have like 5 books to give away of He Lei no Emalani. So this is where Poke all of my pulled archives and translated. So I have 5 copies, and I have no idea how I'm going to give these away. How about, how many of you were born at Queens? Raise your hand. Oh. Only one? Oh, okay. Lucky winner number 1. Yeehaw. How about, how many have visited the Women's Health Center for screening at any point of their life? Mammogram? No? Okay, how about, who ate in the dining room? How many have visited Queens for a procedure and for birth? Okay. How many have been to Queens for a procedure or giving birth or whatever? Okay. So, I see 4. I hope it's only 4. You give birth? Yeah. Okay, so mahalo